Okay, we're going to call this Human Services Committee meeting to order here on April 3rd, 2025. Mr. Heckman asked me to chair this meeting. First, we will get to courtesy of the floor, if there's anybody that would wish to speak. Seeing none, on the agenda we have the introduction of the new Graysdale Administrator, followed by the report from our Director of Human Services. So we'll start with the introduction of the new Graysdale Administrator.
Sure. Thank you, everybody. So it's exciting to first let you know that Graysdale, their administrative team is fully staffed. So administrator, assistant administrator, director of nursing, assistant directors of nursing, risk manager, quality assurance, on and on and on. The county executive and I were talking, and I think it's the first time in a while that we've got everybody in place, and we're really excited about that. So one of the things that the county exec and I have always tried to do for Graysdale is focus on the need for it to stay a county nursing home. And in order to achieve that, periodically we need to change and be dynamic. And the other piece that we have really focused heavily on is succession planning. So both in DHS and at Graysdale. And we think that some of the most important work that we will do is leave behind folks who are most qualified and most skilled to be in the positions that they're in, to continue to keep Graysdale a county nursing home. So we are very happy to have hired Michelle Morton as our new Graysdale administrator. Michelle is with us tonight. You can come on up. Michelle has a long history of nursing home experience and being an administrator, and was not afraid of the size of Graysdale because of the many places she has been. So I will go over the Graysdale report then, but just wanted a chance for Michelle to introduce herself, and if folks have any questions for her, she can answer them.
Hello, how are you? Good. So, did you want me to do a summary? Or?
No, if anybody has questions.
This is the first time I believe we're meeting. Can you give the committee a bit of background about yourself, who you are, where you came from, any goals and objectives they have moving forward?
Okay, sure. So I started in this field about 40 years ago. I started out as a recreational therapist and was very involved in leadership in that position. So then eventually earned my personal care home license, then my assisted living license, and then eventually my nursing home license. And a brief interim in there, I also was a state surveyor for 3 years for DHS, surveying personal care homes and assisted living homes. So a long history of being in this field. Most of it was in long-term care, so in the nursing home setting, in both private, for-profit as well as nonprofit. So I think that variety of experiences combined with the state, you see the good, the bad, and the ugly when you're doing that. So it does give me a varied background to be able to deal with the challenges that we have. Right now, this is my third week in. So a big part of what I'm doing, obviously, is building rapport with our team, our leadership team, assessing our needs, looking at our operations and assessing them, looking at how can we operate in a more lean manner. And by that I mean, obviously finances are always an issue, but looking at just the efficiency and redundancies. So lean is more than just the financial piece. It's okay, how can we streamline operations, or who's attending what meetings? Does everyone that's there need to be in that meeting, or could they be doing something else? So really just assessing all that so that we can move forward.
Anyone have any questions? Mr. Gafredo?
So have you ever managed from the position that you're in now, a nursing home?
Yes, I have. My most recent position was at the Phoenix Center in Phoenixville. So it was the same position. It was a smaller building than we have at Graysdale, but the challenges were a lot greater with it being a for-profit organization.
How many beds was that Phoenix Center?
That was 180 beds.
And how long were you in that position for?
That position I was in for 2 years.
And I know you've only been there for 3 weeks, but what would you say the 2 or the 3, I guess, biggest accomplishments you want to make at Graysdale, things that you think could help turn, we're definitely in a position where we have, I think, close to 80% staffing age. So I know getting more county employee nurses and nursing aides and staff there would be a big accomplishment. How would you accomplish stuff like, what type of things do you want to do differently than the previous administration there?
Well, obviously census, staffing, and then looking at things like quality so that we become a preferred provider for our local hospital systems. Those are all key. Some of the things that I've done as far as staffing, we really need to look at not just recruiting, but how do we retain staffing. So one community I was at, not the Hill at Whitemarsh, I'm sorry, I was there, but at Rydell Park, we actually formed a staffing retention committee while I was there. And through that committee, we really looked at, okay, why are we losing staff? Because we were hiring there and losing people frequently. So we looked at, okay, why aren't we keeping them? So we formed a committee to address that. And in less than 3 months, we dropped that staffing turnover 50%. So I want to look at doing some of those same programs here at Graysdale. We need to figure out how do we keep staff once we get them on board.
Obviously, come to us with anything you need for help. Thank you.
You're welcome.
I like what you said about efficiency too, and I think, as we continue to move forward with, whether it's all departments here, and I know the county executive and his team have been working for many, many years on how do we become more efficient as we are moving forward. Things really aren't just status quo. We want to make sure that we have the best facility possible for people who are entering a certain stage of their life. Quite frankly, I have a feeling my mother is going to end up at Graysdale at some point in the future, and whether it's my mother, or whether it's my neighbors' parents, or whether it's folks from various areas of the county, making sure that we are more efficient at Graysdale, I think is an endeavor that we're going to need to continue to work on. And if you need anything from us members of council to help in that regard, please come to us, come to me. I would like to help out as much as possible if I can.
Okay, thank you.
Anything else from the committee for our new Graysdale administrator? Okay, well, thank you very much. Thank you. Wondolowski, you're going to provide us a update here? Graysdale report? Okay. Thank you.
You will find them to be single slides per page, so they are more legible this month. So I told Michelle that it was only fair that I run through this with her, or through this for her this month, and I'm sure in the very near future you will be hearing from her instead of me. So this is our March report, which really covers February. I like to remind people of that. So the first, well, it's actually the second slide, reviews the February PPD. And if you recall from last time I talked about it, we break it down now by the PPD that's on the unit, the PPD that is total in-house, and what's reported by PBJ. So we are still a little bit ahead of what the minimum PPD is, and we're working on that as well. If you recall, PBJ takes into, the numbers are always going to be slightly different for PBJ. That takes into account the folks who are here an extra 10 minutes, 15 minutes, things like that to finish up on their shifts because the reporting goes from 11 to 11. So if somebody's working the second shift and doesn't leave till 11:15, that time is captured on the PBJ report. Third slide is the census, which you can see, so 2025 is the yellow, and you can see that is definitely going up. So the average census for February was 463. Earlier in the week, the census at Graysdale was 482. So we are working towards that target of 500 long-term and 20 short-term. Any questions? Okay. Slide 4 is just the hospitalization rate. Luckily, you will see the next, I'm going to talk about these all at once. So slide 5 is the breakdown between LVHN and St. Luke's. Now I'm really jumping around on you. So what I wanted to say, though, was the infection rate, which is slide 8, and then slide 9, my point of the hospitalizations was that you see the February numbers. There was a large jump in flu, 1 RSV, 1 COVID, so that was down, and 3 neurovirus. And March, those numbers were much lower. So getting through those seasons as well. Slide 6 is the weight loss slide. We talk about that. Here, the average or the percentage of weight loss that was significant was a total of 5.8% of residents. And there was 27 residents that had weight loss or weight gain. What we're finding the last few months is that the large majority of folks are on hospice or are considering hospice or have been sick with the flu, neurovirus, or COVID. So I talked last time about the supplemental nutrition program that they were piloting, and that continues to go really well. And our dietary folks and all of Graceville are really excited about that. Slide 7 is the falls, and we'll be able to get into this a little more, the next time Graceville meets, when Michelle's got her hands in a little bit more, but there continues to be significant efforts at Graceville to try to figure out the reason for some of the falls, and I think by next month you will see that there's been some decreases because of just some easy shifts of meal timing, bed timing, things like that. And so we'll be able to talk to you about those more in the future. So if I'm not mistaken, that number in March was already lower. So that's where February was. And then last slide, 10, the most important slide for me is you will see we average just about 1 visit unexpectedly a month from the Department of Health. Due to complaints that either staff or residents or other folks make, and every single one listed here in 2024 and 2025 was unsubstantiated. So it's nice to know that even when the DOH shows up every month, we have not yet had any issues with whatever the actual complaint was. So any questions about Graceville? That's what I have for Graceville report.
I think Mr. Gofredo had a question.
How are you, Sue?
Good, thank you.
All right, so obviously we have new administrator. What are we gonna do to help her succeed in the role? Obviously, nobody's gonna, it's a challenging role, very challenging situation. What are we gonna do to help her succeed?
That's a great question. It's one that I posed to most of the Graceville administrative team a few weeks ago. And in fact, it may have been silly, but I tasked them all with identifying 5 specific ways that they would personally support Michelle in her role. And that, I think, was a really helpful exercise for folks to, first of all, to team. Michelle can't succeed or fail on her own. She needs the support of everybody. So far, one of the things I like a lot about Michelle is, as folks have said, "Oh, you keep coming back every day," and Michelle's answer was, "This place is great. Yes, there's issues. There's always issues. There's always things we can improve. But based on prior experiences, especially with the for-profit homes, they're just run totally differently." Michelle is not afraid of the challenge that is Graceville. It's just bigger.
Well, that's good, because I think perception and morale are a big thing that we can control and help to influence positive morale there. I think that's such a huge thing. Obviously, you're always going to have people coming in here saying we need more money, but there's a limit to that, and that can't fix everything, but.
Yep, agreed.
Management styles, morale, and just being generally positive would be a big help, but, obviously, if you guys have creative outside-the-box ideas, bring them here. We're here to help. We want to see you succeed.
I'm really excited about the direction that Graysdale is headed and the trajectory. I think we're going in the right direction. You're welcome.
The one thing I'm still excited about is the daycare.
Well, I'll give you an update then, Mr. Warren.
I'd love to hear where we are. Look, there were some local-based hiccups, not
Well, there
necessarily
still is.
anything with
So
Unreal.
our local township there came to Graysdale. Graysdale wasn't expecting them. That's fine. The daycare wing is ready. It's ready for inspection, so that wasn't a problem. But the township needed to see something related to the fire system and how it all operates separately or can be shut off or turned on. That's, it's a Mike Amelie thing, but they said, no problem, we'll demonstrate that for you. And the township said, oh, we don't have time for that today. We'll come back. And I think that was about 2 weeks ago.
Okay, thank you.
You're welcome.
Yes, Mr. Brown.
We have a contract for the administration of daycare.
Yes, with Learning Locomotion. I think that the way the contract was written so that they could be paid to come in and help set up the daycare, there's different hourly rates. And the last time, I think when I was here last month, we had paid out about $900 or $1,000 so far. Small, very, very small number so far that has gone to them. Once the daycare is licensed and then they gear up towards staffing, there'll be some overhead there until their kid's there. But that was the number that I got from HR, was about $1,000. Can you control Nazareth Township?
No, it's
Yeah, I can't answer that. I'm
a
not.
direct question because, we're
Yeah. Yep. I wish I could make the township move a little quicker. I don't have any control over them. Yep.
And that company that we paid that $900,000, they were there doing
900, no,
work.
just $900.
$900, that's what I mean.
Yes.
Because they were there doing work.
Yes, oh,
correct?
absolutely, yes.
Yes, just want to be
And to
perfectly clear
their
about that.
credit, they spent many, 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 many hours in the early planning discussion phases over probably a year or two before we even got to the point of we should probably talk about how to be compensated to a small degree for your time. And that's just for the setup of the classrooms. That's it, nothing else.
I'm enraged by the township at this point. I don't care if I'm saying that publicly. I couldn't care less. This is something that has been ongoing and talked about within the community for months and months.
Years.
And now the last time they've been out is 2 weeks.
Well, I gotta ask, who's supposed to be scheduling all these inspections to get the final C of O for the daycare?
Well, we are at we're beholden to the township. So the township is,
It's their schedule.
yeah.
Yeah, but typically, so wasn't there paperwork that wasn't filed? That's what kind of set off this delay with the state and,
No, the state came back when we ultimately needed the certificate of occupancy, the certificate of occupancy. At that point is when Upper Nazareth said that they had to come out and do an inspection in order to provide the Department of Health with their final kind of stamp of approval. So the DOH has now, and has for some time, approved from their end, and that's all we're waiting on for the daycare to pursue their licensing with the state. They can't do it without the occupancy. So if anybody, I'm not afraid to ask for help. If somebody can get the township back sooner than later, we're happy to accommodate them anytime, any day.
and you guys, I'm assuming, have called and tried to schedule that inspection?
Mike
reschedule?
Amelie has been, he certainly knows more about that than I do. But yes, he has taken care of that.
Any other questions with regard to Graysdale? All right. I think you have some other
do.
issues to get into, Ms. Wondolowski?
I do. So I'll just give you a few different updates. I'm going to start with aging. I've been talking with Lori Stanton-Laney, who has been in that role just about a year now. And we were talking about, you all have heard me talk about the increase in the reports of need and that volume. So she actually pulled numbers for me. And so I just wanted to share those with you guys. I know sometimes you guys like that information. So in 2018, so that was when this administration first got here, there were 723, we call them RONs, reports of need. So there were 723 RONs. I'm not going to go year to year, but it increased every year except one. And last year, 2024, we had 1,735. So we have increased our protective services staff over the course of those years. We haven't doubled them, and those numbers have more than doubled. But it's just important to talk about protective services is the top priority in aging. And so Lori's team is doing a good job juggling that, but it's the influx is substantial. So I just wanted to let you all know that. Any questions about that? Okay. Has everybody seen the RISE van yet? The billboards, the RISE van? No? The RISE van, the Drug and Alcohol RISE van, recovery initiative supporting everyone. So we have it, it's at the DHS parking lot. It is heading on the road. It's been to various places so far. We are looking to partner with many different kinds of community providers for events. So the goal of this outreach vehicle, as you'll all remember, was to provide outreach services to folks in our community who we know need them, but who are not accessing them at one of our recovery centers or with a provider. So we're partnering with our own mental health folks. They go out in the van as well. It's not just, I mean, obviously the primary focus is drug and alcohol, but we do that with mental health. I talked before, we're going to try to partner with street medicine from the health networks. The health networks have their own mobile vans now. We've talked about partnering, related to some physical health stuff. So we're really excited about that. They have their own Facebook page now. Do you know what it is, Robin?
Yes, it's Rise Van LV.
Rise Van LV. So check them out on Facebook, like it, share it. But you can follow along there to see where that van will be, and feel free to take a visit. It's pretty amazing. So while we're on the topic of drug and alcohol, our folks were at their state meetings a week or two ago, and it was doom and gloom. So historically, you all have heard me say we have treatment money out the wazoo. We always had enough treatment money. We got notice a week or two ago that, with no dollar amount yet, that some of the federal funds are being frozen. And so we don't know how much that is. We don't know what that will mean down the road. In terms of immediate impact, we've been able to minimize that, and it's really in terms of some of the recovery programming that we do. We've, scaled back on some of those things that are not, impacting treatment. But that was really disappointing, and they talked about the impending changes to Medicaid, which could have just a substantial impact on human services. So that's not good news, obviously, but just something for council to be aware of. I have no asks. We don't need any more money, but it's something that we are having to take a look at and plan around now. So I just wanted everybody to be aware about that. Any questions about that? Okay. Lastly, the ORLTSR, the long-term structured residence over in Easton, is full. So that's something to celebrate, because I was coming here year after year saying it's almost ready, it's almost ready. We're full. So that's an 8-bed facility for folks who had been coming out of jail, and Comar's managing that, and we are very pleased thus far. So if we had another 8 beds, that'd be amazing, but that would take an awful lot more money from the state and feds. So that's my report, Mr. Warren.
Thank you. Do you expect those beds to remain filled?
Yeah.
I mean,
Yes.
we're gonna have them filled pretty much from here on out.
I can't imagine a time when they would not be.
Great. Any other questions for Ms. Wondolowski at this point? All right, we will adjourn.
Thank you.
Thank you very much.